An experimental drug is now in use at UC Health hospitals in Colorado Springs, hoping to prevent those with COVID-19 from being hospitalized. KRDO News Channel 13's Chase Golightly spoke with a pharmacist at UC Health about the drug and joins us live in Colorado Springs with what we've learned. Chase.
Heather, the medication is called bamlanivimab, and it's only given to patients who are not already hospitalized because it's so new. It's in very limited supply. The first person to receive it in Colorado Springs was just last week.
So far, 7 people in Colorado Springs have been given this drug called bamlanivimab at UC Health hospitals, an experimental medication meant to prevent people's COVID-19 symptoms from worsening.
That kind of neutralizes the virus and hopefully you can get rid of it.
Carrie Beckman, a pharmacist for UC Health Memorial Central, says it's also meant to prevent people from being hospitalized, which is an ongoing statewide issue. While the drug is still in its clinical phase, they've seen success with it.
I don't want to say that it's a miracle drug and it has, perfect efficacy, but I think anything that we can have to help keep people out of the hospital is worth having.
Beckman says it's a one-time treatment. Patients are given the medication through IV, and the process takes about 3 hours.
The side effects are some nausea, some diarrhea, dizziness. There is a small chance, like any monoclonal antibody, when you get this medication infused, that you can have a reaction.
But not just anyone with COVID-19 can get it.
It's for patients who are at high risk of getting severe COVID-19. So it's for patients who are 65 and older, for patients who have diabetes or other disease states that would have them be considered immunocompromised.
You also have to get the medication within 10 days of testing positive. And even if you do fall into that category,
we do need to have an order from your doctor or from your provider before we can give this medication.
Bamlanivimab is still very rare and in limited supply, with UC Health given 650 doses. Once you do qualify for the drug, patients will then be picked at random for treatment.
Now, this drug is different than the one President Donald Trump received when he was hospitalized with COVID-19. President Trump was given remdesivir, which is only given to hospitalized COVID-19 patients. This new one, again, is only for patients who are still at home and not in the hospital. Reporting live in Colorado Springs, Chase Golightly, KRDO News Channel 13.